Hi, I'm Dr. Mini. Welcome to my page Health with Dr. Mini. So here I'm going to make your common health issues more simplified and more understandable and easy. So as the first episode of mine, I'd like to talk about a thriving issue in this society, that's diabetes. So people ask, what are the early signs, what are the alarming signs of this diabetes to diagnose it? So if you're passing urine more often, like you're frequently waking up to pass urine, and if you're thirsty all the time, if you're feeling tired all the time without even working, you're tired, and if you feel this, all of a sudden you feel this hunger, and if you're experiencing sudden weight loss without even dieting, without even having a proper reason for it, you might be having diabetes, because those are the 4 alarming signs of diabetes. Some people ask, what is this prediabetes and whether it can be reversed or not? So what is prediabetes first? If your fasting blood sugar level is between 100 to 125, you call it prediabetes, which means you are at risk of diabetes. So here's the good news. You can totally reverse it by modified lifestyle, by exercising, by cutting off sugary snacks, sugary drinks, and by having more veggies, proteins. I'd like to bring all these what to eat and what not to eat list in next episodes, but we'll discuss it in brief here. So by using these all modifications of the lifestyle, you can reverse this prediabetes. That's the good news. So what is the relationship between this exercise and diabetes? So let's get it simplified. So when you're exercising, so your muscle pump is like your glucose store. So when you're exercising more and more, your glucose gets absorbed to the muscle, and then these muscles consume those glucose, so your blood sugar level goes down. So even 30 minutes of walk or 30 minutes of cardio per day will help to control this diabetes. Another thing is, some people say these fruit juices are good for health, and some people say fruit juices are not that good. So what's this rationale behind this? Here's the thing. So I would say fruit juices are not good for those who are at risk of diabetes. This is because fruit juices cause a high blood sugar spike, which means fruit juice, when you're having fruit juice, all the sugary stuff, all the sugar in this fruit juice directly and rapidly absorbed to your blood, which cause high blood sugar spike in your blood at that time. So it's not that good for diabetic control. So what is the relationship between this stress and the diabetes? Stress causes hormone called cortisol to increase in your blood, to secrete more and more cortisol in your blood. This cortisol hormone increases the blood sugar level. So that's why stress is a risk factor for diabetes. So you need to have relaxation module in your routine. So some of you guys ask, how is sleep deprivation causing for you to put yourself at risk of diabetes? So poor sleep means insulin resistance. So what is this insulin? Insulin is our hormone which helps to reduce the blood glucose level, to lower the blood glucose level. When you have a poor sleep, what happens is your insulin resistance in your body gets high. If you are not having 7 to 8 hours of proper sleep during the day, it causes to put you at risk of diabetes. So remember, sleep is important as that. So stay connected with the page. I'll be bringing you stuffs regarding what to eat and what not to eat to control diabetes and how to diagnose this diabetes.